Well, Kathy, I wanted to thank you for volunteering to share your story with our patients, and because it will help other patients who are suffering from the same symptoms know that there is help out there. So if you don't mind, just let me know a little bit about your history, what brought you here, and how far you've gone.
Okay, it's my pleasure. I started with TMJ in 1983.
Oh, wow.
That makes it 42 years. I've been to probably 15 different dentists because of all of my moving. That was part of the problem. I've had 2 sets of crowns, at least 16 each,
I remember.
over the years. So I had gone to my ENT physician here in Portland, complaining of it,
right?
Dr. Farr, and complaining of an ear infection. And he looked at it and he said, "You don't have an ear infection." And I said, "But it hurts really bad and it's in my ear and I can't seem to make it go away." And he said, "I'd like to refer you to Dr. Motlagh." And I said, "Well, who is she?" "She's a dentist." And I went, "Really?" He said, "I think your problem is TMJ." So I made the appointment and I came in here and we did some work and we got a fixed orthotic to start. And at that time, you had recommended that I may want to think about a full mouth restoration because my teeth were worn down quite a bit.
Because of all the grinding, all these years of grinding, so your teeth were worn down. Yeah, but you kept the plastic for a while, right? For about a year or so.
Well over a year, but because my husband had cancer, I just put it off, and it was more important to do what I was doing then. And then I came in December of last year and said, "Let's do it." And the process it's a long process, but it's not a difficult one. It's when you have the first appointment to grind your teeth down and put your temporaries on. It was one appointment. It wasn't that hard.
6 or 7 hours.
Man, I was kind of out of it. Then we had the temporaries on for a while they were making the permanents. My TMJ has almost disappeared. I still grind. That's not something I'm gonna may not get over. But at the same time, my teeth are so much better. They look so much better. And the TMJ doesn't bother me during the day.
Not that feeling of ear infection.
Oh no, none of that feeling anymore. That's gone away.
And we just gave you the mouth guard for the nighttime wear, so that's going to help a little bit more with the clenching that you're doing at night.
But it's virtually disappeared. The problems I had, the pain I was in,
the headaches, the muscles,
the neck pain. There was so much neck pain.
Because nobody looks at the neck alignment usually. When we restore the bite, the neck alignment is so important.
Exactly.
And all that tensing, the deprogramming of the muscles that we did, was that helpful?
That was wonderful. That was really wonderful. And be able to feel your mouth move smoothly for a change instead of clicking all the time and getting caught. That changed quite a bit.
You were telling me that you considered surgery. And you went for a consult.
I went for a consult in St. Petersburg, and I was considering doing the surgery. It's going to cost $27,000
to do the jaw surgery.
To do the jaw surgery, wiring the mouth shut, replacing that bursa, that sac with fat from another part of the body. Maybe it would take, maybe it wouldn't take. And I was advised. I called several of my older dentists that I had gone to in different states and asked them what they recommended. They said, "Don't do it."
Because the surgery usually gets repeated.
And I even called 2 of his patients who said it didn't work. He thought they were going to say it did work. But
well, if the problem is the bite damaging the joint, the solution should not be surgery on the joint. It should be fixing the bite first. Some joints need surgery if the disc is perforated or completely damaged.
Correct.
But you have to correct the cause of it first, correcting the bite. And then a lot of patients like you won't even need the surgery after that.
That makes all the sense in the world to me. Go to the source.
Exactly.
But You're the best dentist
Oh, thank
I've
you.
ever had,
Oh, thank
honestly.
you so much.
And I'm
Yeah.
66. I've been to a lot of dentists.
It's
And
been
what
a
I also
pleasure.
like so
Yeah.
much is you explain everything you're doing
Thank you.
as you
Yeah.
do it. So
Mhm.
there's no fear of, like, what was that about? Why do you have to do this?
Mhm.
You tell me up front.
Yes, thank
And
you.
that's important and makes you feel very confident.
Great. Thank you so much.
You're welcome.
What is your advice for other patients that are suffering from headaches and TMJ, you know, and yeah, any recommendations you have? Yeah.
I would tell them to seek you out
Consultation is
right
important,
away. Yeah. Get all your questions answered.
Mhm.
I wish I had met you a long time ago.
Thank you.
I really
And
do.
it's not just me, as you know, we have a healing team between our upper cervical
Yes.
chiropractors, physical therapists, who are all involved, myofascial therapists, who are involved in improving the head and neck posture and orthopedics.
Yes.
And that's why the treatment is successful, because we're not ignoring other parts of the body that are affected by
Correct.
it, like your neck.
Yeah.
Yeah.
When Dr. Brooks with the neck,
Yeah.
it was excellent. I've been going to chiropractors for 35 or 40 years.
Yeah, but not every chiropractor is an upper cervical
That's
chiropractor
correct.
that specializes in these two
Yes.
vertebrae. So I'm glad.
Yeah.
I'm glad that we're changing lives every day. It's
I am
so
too, 'cause it
rewarding.
changed
Yes.
mine. It
Yeah.
really changed mine.
Yeah.
And I really thank you so much.
Oh, thank you. Oh, you're the best. Thank
Oh,
you.
well,